So good evening, everybody, and a big welcome on International Women's Day from Trinity Women Graduates and Women in Research Ireland. My name is Sandra O'Connell, and I'm the president of Trinity Women Graduates. My own background is not in science or medicine. I studied English in Trinity School of English many years ago. But our co-host this evening, Dr. Joanne Kenny, is a scientist and also honorary secretary of TWG and a co-director of Women in Research Ireland, together with Susan Fedex, who's also here. And we will be joined also, or we are being joined also by our Vice President, Lucy Corcoran. We've got Anna, Emily and Cassie, and everybody here is helping them with the questions, with the Q&A afterwards, because we're hoping we're going to have a very lively Q&A. We're hoping to keep this event very, very conversational. So a special welcome now tonight to our two speakers, Professor Aoife McLysaght from Trinity College Dublin and Professor Máire Connolly from NUIG Galway. Joanne will introduce our speakers shortly, and we look very much forward, as I mentioned, to a lively Q&A with our speakers and to hear about their career paths and their perspectives on the COVID pandemic, both in Ireland but also globally. Our event to mark International Women's Day last year took place on the ominous day of 12th of March 2020, or I should really say took not place on that day because Trinity College had to close its gates on that day. It was the very first day that Ireland went into lockdown, and little did we know back then that we would find ourselves in the same situation 12 months on. But we're delighted to be together in this online format to mark International Women's Day and celebrate with you today the achievement of two women leaders in the global pandemic. And I'm sure they're undoubtedly role models for many young women starting their careers in science and medicine. Our theme this year in Trinity Women Graduates is courage and curiosity. And it is inspired by those women who fought hard a century or more ago to gain admission to Trinity College or indeed any other academic institution in Ireland. But especially those women also who kept challenging over the ensuing decades the world of academia to achieve equal status. At Trinity, where women were first admitted in 1904, this was only achieved in the 1960s, and until then, women were excluded from basic services such as attending the dining hall. They were excluded also from college societies and many more. But as I said, the focus today is on achievement. And from the early days, women excelled in their studies and research, winning medals and scholarships across many academic fields. And they are just two of many women I might mention briefly today, and they were amongst the first graduates in the early days of the 20th century. So at the beginning of Mcleish term in 1904, there were 47 women admitted to Trinity, and 3 of those were in the medical school. Dr. Lily Anita Baker, who had begun her medical education at the Royal University, had transferred to Trinity in 1904 and graduated then in 1906. She became an obstetrician and had a distinguished medical career in England, where she served in the Women's Royal Air Force Medical Service during the First World War. And she was later appointed to Bristol Royal Infirmary in charge of the antenatal department before being the first woman to hold such a position. Another of the women admitted to Trinity in 1904 was Sydney Auchinleck, who wanted to be an engineer. But as this was not open to women at the time, she became the first female chemistry graduate and a mechanic in her spare time. And you can find out more about the fascinating story of women at Trinity College in Susan M. Park's wonderful book of essays, A Danger to the Men, A History of Women at Trinity College Dublin. It's a wonderful book to dip in and out of. Our own graduate association was founded in 1922, so we will celebrate 100 years next year to connect with each other and to remain also connected to Trinity. But above all, we were founded to give women a voice in major political and societal debates. And with this, I would like to hand over to my colleague Joanne, who's going to introduce our speakers who are debating tonight with us such an important issue as the COVID pandemic. Thank you.
Hi everyone, my name is Joanne Kenny and I'm co-director of Women in Research Ireland and Honorary Secretary of Trinity Women Graduates, as Sandra mentioned. And I'm very excited to announce our two fantastic speakers today on International Women's Day 2021. So first off, we have Professor Máire Connolly from the School of Medicine, NUIG Galway. Back in 2017, a research report led by Professor Connolly warned that the risk of a pandemic emerging is greater than ever before, and that improved preparedness was necessary. Professor Connolly has said that it is quite eerie how things have actually transpired following her warning in 2017. Luckily for all of us, the second phase of this project has received €10 million to help prevent future pandemics. In addition to this amazing work, she is currently Public Health Advisor to the Department of Health in Ireland on the COVID-19 response and a member of two advisory groups to the National Public Health Emergency Team, or NPHMI. Professor Connolly has worked with the World Health Organization from 1995 to 2012, where she traveled across the globe working in many war-torn countries. So it's been truly an amazing career journey. We also have with us Professor Aoife McLysaght from Trinity College Dublin, who is head of the genetics department at TCD, where she leads a research group focusing on molecular evolution since 2003. She's been involved in groundbreaking research on the human genome sequence. Professor McLysaght takes a keen interest in communicating science to the general public in an engaging and accessible manner. She has given many talks at public events and interviews, and she has a fantastic TED Talk, which I would highly recommend you all watch. Professor McLysaght is a member of the Independent Scientific Advisory Group, or ISAG, which is a multidisciplinary group of scientists, academics, and researchers who have come together to advocate for a COVID elimination strategy for the island of Ireland, a group which is independent of government. So with that, now I'm going to pass you over to Professor Máire Connolly, who's going to give you a talk about her research and her fascinating career path to date.
Thank you very much, Joanne, and thank you, Sandra, for the introduction. I'm going to share my screen because I've got just a few slides that will bring you through my career path to date. So let me see if I can share my screen here. Okay, can you see my screen?
Not yet, no.
Okay, go back there and see if I can.
Maura, if you'd like to maybe send them to Joanne, we could try that as well. They're not too big.
Also, now you're on mute. Sorry.
Maura, you're on mute.
Okay, I'm just wondering, Sandra, Joanne, would it be an idea if we started with Aoife and then I can send the slides to you guys to open them there? Would that be a possibility?
That's a good idea.
Okay.
Yeah,
if that's okay with Aoife.
Excellent.
Good problem solving.
Of course, yeah, good problem solving. And of course, all of this worked perfectly in rehearsal. I'm sure there must be a scientific explanation for this.
It's Murphy's Law, isn't it?
Yeah. There you go. Sent that on.
Thank you. Thank you very much. We'll get that up for you in a moment. But yes, absolutely.
Yeah, so Aoife, I'll kick off with the questions here. So you've led a research group at Trinity focusing on molecular evolution since 2003. And could you tell us a bit about the work you do in your research group? And as a follow-up point, what advice would you give to early career scientists who aspire to follow in your footsteps and set up their own research groups?
Sure. So molecular evolution really just describes how we analyze genome sequences and try to understand what's going on with them. And this is something that has achieved a lot of attention recently in the research area in general, because we've seen people doing this for the SARS coronavirus too, kind of in real time and in the news every day. So that's not my work, but it's the kind of work I do. It's the same general category of work in that, you know, looking at the genome sequences, comparing them, looking at the differences, and then understanding the patterns in what we see. And I'm very proud actually that a student who did her master's in my lab is now doing her PhD in Edinburgh, and she is working directly on that. So she is part of the big UK genomics, SARS-CoV-2 genomic surveillance project. So what we do is we look at genome sequences. My work focuses on looking at vertebrate genomes, and we look at those and we try to understand the patterns and processes of evolution, and in ways that we can then interpret to make sense of the genome in terms of one of the things we do is try to understand what you might categorize as weak points in the genome, if you like, you know, parts of the genome that based on their evolutionary patterns, you can see can't tolerate any changes or any variations. And the reason a change might not be tolerated is because it would lead to disease, for example. So an evolutionary lens is a way of very rapidly taking advantage of a huge amount of genomic information, because we have so much information now. You know, it's really the modern era of biology. We have so much data, and understanding it is the thing. So our work is all computer based. So that's generally what we do. And the main questions we're trying to answer then are looking at the genome in terms of trying to understand where new genes come from and trying to understand some of these evolutionary constraints. So in terms of what was the second part, how to encourage people in research in general?
Yeah, like just aspiring scientists who are eager to set up their own research groups to follow in your footsteps.
Yeah, so I think the key, which I think for everybody, the key is finding something you're really interested in, because I think that is, it's really necessary to be self-motivated in an academic career in general. And that comes from being interested in the topic. So, you know, fiddling around and poking around until you find something you're really interested in is really important. But there is the real hurdle then in the final step is, of course, getting an academic job in a university. And those are few and far between. But if anybody was applying for one of those jobs, if they got to the stage that they want to apply for one of those jobs, one piece of advice I would give is do ask around and ask for help. And this is me speaking from experience. The first time I was going for something, I didn't ask anybody for help, and I didn't know what to expect, and I didn't know how to best prepare. And it turns out people are very happy to give you help if you ask for it, but they don't know you need it until you ask for it. And, you know, I made obvious silly mistakes that I recognize now. I should have, there's certain things that you always need to be ready for in an interview like that. And I wasn't, because I hadn't asked anybody what kind of things should I be thinking about in advance. And, you know, that is something I would recommend to people. Do ask around, you know, ask people you know and you like, and they don't have to be necessarily in the exact topic you're applying for, because how to prepare for this kind of interview is kind of similar. And then getting started, I would say the same thing again. If you get a job and you're in there, do ask people for help and ask around and learn from other people, because that will be a huge help for anybody in the job. And then and I would say in the interview context, our interviews are a bit funny in that they're quite short. They're making a big decision in a short amount of time. You've got hardly any time to present yourself. But I viewed it a bit like a performance in the sense that I don't really like talking about myself and I don't really like bigging myself up. But I was like, look, if I don't do it, nobody will. This is the time when I have to do it. So even though it wouldn't be the way I'd like to behave normally, and certainly if I ever did that in a social context, I would fully expect to be told to shut up. This is not a social context, and you do need to say why you're very good and what makes you good at the thing you do and what are your good achievements. So that'd be the other bits of advice I'd give, but that'd be the general advice. And I would say if anybody listening is looking to go into that kind of career, I am one of the people who's happy to be contacted for advice.
Could I ask a quick burning question there, Aoife? Is this something that you think men are doing better than us and that we just have to become a little bit more, confident, at things like interviews or asking for things in those situations or presenting our achievements? Does it maybe not come so natural to women?
It might. I've heard that said. I don't. Yeah, maybe that's one of the things. I don't know that firsthand. Definitely you need confidence in an interview situation. I think the problem isn't all on the interviewee side, though. So I think interviewers. I think there's interviewees who could do everything right, and the interviewers need to be told a thing or two as well. And I do my bit for that too. I have told people that they're not holding people up to the same standards, and I've made that point very bluntly.
And many of our women in research group are early career, mid-career scientists, and we're all listening closely to your advice. You might have a few people contacting you after this, but yeah, it's great to get advice from you. So a follow-up question to that is, so you've been part of some major genomic research, and you were part of the international consortium that published the first draft of the human genome sequence in 2011. And you spoke about having, excuse me?
2001.
2001, excuse me.
History, yeah.
You spoke about having an intense interest in your research, and that's very important. But initially, what sparked your interest in genomic research and led you to pursue a career in this area?
I think maybe like a lot of other people, it's certain chance events. So I came to Trinity to study science, knowing I really liked biology, thinking I probably liked genetics. But to be honest, my knowledge of what genetics was at that stage based on school genetics was really slim. So it's almost a coincidence that I still liked it when I learned more about it, seeing as I was, my decision was based on so little. But, the Trinity structure allows you to enter in broad course and then choose. So I still had time to make that choice. And I just, when I started learning more about genetics, it just worked for me. I enjoyed it. I enjoyed the strategy, which is thinking about understanding the problems. And the thing about genetics that really, really appealed to me was being able to, the fact that it is kind of the common language of biology, that you learn something in bacteria, but it applies to humans, in terms of how genes work and the base, and even some of the way signals are transmitted and the way genes work and these things. And then evolutionary genetics is taking this a step further because it's across biology and across time. And so I found that really, really fascinating, interesting. And I really, really enjoyed thinking about analyzing and understanding genomes. It's just what got me most interested. And so I was very, very lucky. In Trinity, we have had a really long and strong tradition in this field. So it was started by my PhD grandfather, so my PhD supervisor, in, I think, the late 80s, early 90s, something around that time, maybe before then. But he started working on molecular evolution in Ireland. He was the first one in Ireland to do this. And it has been a lasting legacy because he's trained people who've then trained people, and basically is almost responsible for this area in Ireland. And Ireland is significant in this internationally. So there's an international society, which is the Society for Molecular Biology and Evolution. It's a big academic society, and this is run by a rotating council, which is people voted by the international membership, which is huge amount of the membership is based in the US, and there's a lot of in Europe, and then a lot in Asia, especially China and Japan. And for maybe nearly 20 years now, there's always been an Irish person on that council of 8 people, you know, because it's like, this is, you know, so it's kind of really significant. And so I was just very lucky, I suppose, in the place I ended up, that I was exposed to this. I really enjoyed it. And I was lucky then to be able to follow what I enjoyed.
Oops. Thanks very much, Aoife. Your passion for the subject is so evident, you know, and so exciting and so inspiring. I have to come now to the topic of COVID. You know, it's obviously still such a burning issue here, and you're part of the Independent Scientific Advisory Group, and together you have made a compelling case for zero COVID, for Ireland adopting the zero COVID model. Did this come out of your research, you know, having observed how the genetic sequences of viruses work, you know, about their mutations? Where did this come from, and why do you think it's the right strategy for us?
So for me personally, I mean, my involvement in the group, I think I was interested in it from a more selfish point of view than a scientific point of view initially, in that, you know, I didn't want to end up in more lockdowns. That obviously didn't work in that sense, but understanding that zero COVID was a strategy to get out of lockdown and stay out, that's what we were interested in. But also then, yes, as we learned more about the virus and the rate of evolution of the virus and the patterns of evolution, that also pushed me more towards, you know, thinking that zero elimination strategy is an important one. So one of the things we see, for example, so, you know, people talk about the variants, the new variants of the virus. So these are, you know, there's loads and loads of variants. That's just saying that the virus is changing. It accumulates about 2 mutations a month on average. But then you have what are called variants of concern, which are variants that have particular mutations or particular features that make them a bit more worrying. And so one of the first ones we heard about was this B117, that people call the UK variant sometimes. And this was part of the reason it was found in the UK is because they have the best genomic surveillance of any country. So they have about 50% of all of the genome sequences we have for SARS-CoV-2 were sequenced in the UK, because they're much more thorough in this. And so they noticed this variant that appeared to have this higher transmissibility. So they kind of said, we think it maybe has, and now of course we know this is true. This is very true. And then another thing we're seeing, so this has particular changes that allow it to attach to the human protein a bit more effectively. That's what makes it more transmissible. At least that's how we think it's happening. And then we see that another thing we see is the same mutations happening in parallel in different parts of the world. So you might have heard about this mutation that's been called E484K. And so this is literally just a description of what happened. It's like an address. So 484 is the position in the protein. So it's 484 amino acids along the spike protein. And an E has changed to a K. And those are just the 1-letter codes for the amino acids. So it's a glutamic acid changed to a lysine. And this E484K has occurred in the South African variant, the Brazilian variant. So the B1351, to call it the proper name, and the P1 in Brazil. And it's happened on top of the B117 as well. And now sometimes people are calling it the Bristol variant. And this is worrying as well, because it's happened in parallel in different parts of the world, which is more than a coincidence, you know. So the mutation is random, but the fact that this has become prominent is because it gives the virus an advantage. And part of the advantage it gives it is that it can reinfect people who've been previously infected. That seems to be what's happening. And that raises concerns, though we don't know for sure yet, about the vaccine as well. And, you know, in terms of the vaccines are good. So that's one thing, the vaccines are all good, and everybody, the best vaccine is the one you can get into your arm. But the vaccine might be less effective. So we might need another new updated vaccine to cover you properly for this one. And so with all of this happening, so, you know, and the virus changing all the time, the best thing, we've been kind of chasing behind the virus the whole time. And as you mentioned, it's now that we're coming up on the 1 year anniversary of lockdown. And so the idea of zero COVID is to actually get ahead of the virus, to really stamp it down, stamp it out, to stop re-importing it is one of the things, and to get it sufficiently under control that we can deal with it with non-lockdown measures. And it essentially recognizes that it's very hard to keep the virus at moderate levels. And the government have said this now themselves in their latest document. They acknowledge that you can't really keep the virus at so-called moderate levels, because those low levels don't stay low for long, because the virus does what the virus does and it keeps spreading. So that's how I got involved in that and interested in that. But and so that my scientific interests do come into it, but it's also just wanting to get back to normal life.
Absolutely. And do you feel there was a point in Ireland, maybe sometime last year, when our numbers were so low down that we nearly got there? And if maybe we had persevered and kind of locked down at this particular point in terms of zero COVID, we would be in a better place now?
Definitely. So there were parts of the country that basically were at zero COVID. Like there were parts of the country that had no cases for 13 days in a row. And the kind of the formal definition of having achieved full elimination is 14 days in a row. And there's recent genomic analysis from Professor Paddy Mallon, who works in UCD and also in Vincent's Hospital. And what they did was they did whole genome sequencing on samples that came from the first wave and samples that came from the second wave. And they could see that in our first wave, we had a few different variants. These are not variants of concern. It's just that we can recognize what they are and we see that they're different from each other. A few different variants, and they were all completely eliminated, apparently. So when our numbers crashed, they were all removed. And when you look at wave 2, you could ask, okay, was wave 2, was it a rekindling of the embers of wave 1, or was it a whole new thing? And it was a whole new thing. So none of the variants that were there in wave 1 were there in wave 2, apart from one that got found again in one case. What we saw in wave 2 was we had re-imported the virus from mainland Europe, the rest of Europe. Sometimes people call it the Spanish variant. It's B177. It was first noticed in Spain, and then when people started going on holidays, it spread all over Europe, including here. And so that's what we did, and we re-imported that multiple times. So, you know, people talk about if we could wind back the clock to this time last year, what would we do? Well, the first thing I would do is have proper mandatory hotel quarantine. You know, try not to let it in the first place. It was already here by this time last year, but it was, you know, it would have been easier to manage if we had stopped adding more onto it. We could have controlled it then, and then we would have been out of it. So we did wind back the clock because we wound back the pandemic, but then we didn't do that step. Unfortunately, it was recommended by NPHMI. They recommended it the 8th of May last year. There's a letter from Tony Holan asking for that, and they're now getting around to it. So it's not exactly amazing responsiveness, but yes, if we had taken a few extra steps, and when I say we, I mean the government, of course, because the people did everything. The people did fabulously, and they made all the sacrifices. They stayed at home. They did all of these things. They broke all the chains of transmission, and we really got it right down. But yeah, we'd be living in a much more comfortable situation right now. Even if we, you know, and one of the things you say is even if you can't have, even if measures aren't 100% perfect, like even if, let's say, the hotel quarantine wasn't 100% perfect, it would have achieved a lot in terms of stemming the flow. So, and I think one of the obstacles, I think, if I'm guessing from mind reading, is that there was certain hesitation in government to do things that wouldn't be 100% effective. Something might have, they could think of a theoretical flaw in something or a little leak in something, and therefore they wouldn't do it. And unfortunately, it didn't need to be perfect. So this was an example of the perfect being the enemy of the good, I think, in my opinion.
Yeah. I'm sure there are so many lessons to be learned from, you know, the pandemic, how we handled it, how close we got to eliminate it, and now us being back here. And in a way, we will come back to Aoife, of course, with loads more questions at the end of our session, but in a way it leads us on nicely into Maura.
Yeah.
If we have Maura's slides now,
Maura can talk
because
about
Maura has studied, yes, she has studied all kinds of pandemics and global pandemics, and I think it's a fascinating presentation that takes us right back again, you know. So Aoife, thank you so much for sharing your insights, and do stay with us because we will come back to you for a Q&A, but I'll hand over now to Maura.
Thank you, Sandra, and thank you, Aoife. So Joanne, could you put it to full screen if that's possible?
Yeah, if you just say next slide when you want next slide, I will switch the slides.
Perfect. Okay. So I'm going to talk about the road less traveled. So essentially, on the left there, I'm sure you'll be familiar. This is the coronavirus, a beta coronavirus, which is one of 7 that's been known to affect man, but there are hundreds of thousands of them out there. We reckon this was due to one spillover event occurring in Wuhan towards the end of November, early December in 2019. And on the right-hand side is a photograph from Kabul, from a mission, a UN mission I did there a number of years ago on measles immunization. So next slide, Joanne, please. So I'm going to focus on my career in the area of emerging infectious diseases. It started out with working in emergency medicine in Ireland, and then in Iraq, in Baghdad in 1990, where I was on a pediatric rotation, and I arrived there 1 month before Iraq invaded Kuwait. So I got stuck there as a guest of His Excellency Saddam Hussein in the Ibn al-Battar hospital. There's a hospital run by Irish and European medics and healthcare workers. And we were there until we all got out in November, thanks to the intervention of our current president, David Andrews. So I subsequently then worked in Australia in emergency medicine, and then trained in public health medicine. I did a master's in public health in UCD, and then trained as a specialist consultant in public health medicine in the UK. As part of my work in the UK, I worked on a tuberculosis program in the USSR in Siberia. I was funded by the EU, and the purpose of that was to look at what were the current treatment for TB. There was a big problem with multi-drug resistant TB in Russia at that time. And following on to that, I was seconded to WHO in Geneva in 1995, where I started working on tuberculosis in refugees and tuberculosis in women. And that work then expanded to run the disease control in emergencies program, and to work on pandemic preparedness. So I'm going to very briefly go through 2 or 3 of those missions, and then I'm going to speak briefly about the EU research project Pandem1, which ended in 2017, as Joanne mentioned, and the Pandem2 project, which started on the 1st of February this year. And then finally, I'm going to give a brief overview of my role at the Department of Health and some of the lessons that we've learned over the past 12 months. Next, please. So the World Health Organization was established by the UN Assembly as a specialized agency for health in 1948. Next one. And its primary role is to direct and coordinate international health within the UN system. And its main areas of work are communicable disease preparedness, surveillance and response. And I think we can see WHO's role very clearly in the last 12 months on COVID, but it's also working on non-communicable diseases, health through the life course, and health systems. Next. And this is the World Health Assembly, which meets, so the ministers of health from the 204 member states meet every May in Geneva. This is in the Palais, the UN Palais. And each delegation might have, depending 5, 8 people, and they will argue, discuss, degree issues of policy in global health. And this is where issues like seasonal influenza, the combination of vaccines to be implemented nationally or globally is identified. And research priorities are also discussed at this forum. Next. So the role of WHO in emerging infectious diseases and humanitarian response, there are almost two branches of the same tree. So the first, and the one that's really core WHO work, is the area of public health events of international importance. And the international health regulations were revised in 2005 with the purpose to try and keep the world safe. And so the main purpose to provide a public health response to the international spread of disease. And that's what we're seeing now with COVID-19. We saw previously a H1N1 and also during a number of bird flu H5N1 outbreaks that were primarily in Southeast Asia. The second major important part of WHO's work is that in humanitarian emergencies, and sometimes they cross over. In a humanitarian emergency, the purpose is to provide assistance, to save lives, alleviate suffering, and maintain dignity during and after conflict situation and natural disasters. And my work focused on the second for the first 10 years of my work in WHO. And then, and I think the important issue is that operational research is a core component of the response in both of these pillars of WHO's response. Next. And this is the Strategic Health Operations Center, which is where it's the nerve cell of decision-making in Geneva. And this is where information is passed from regional offices from countries and then passed on to the rest of the world in terms of updates on the epidemiological situation of a major outbreak or a pandemic, as we're seeing now. Next. So the areas of research by WHO on emerging infectious diseases and humanitarian response include a rapid health assessment at the outset of a pandemic or a crisis or a conflict situation, the surveillance of the health of the affected population. And we see this now through the laboratory data reporting globally on COVID. Outbreak control is where you've got in a camp, for example, an outbreak of cholera, that you deal with that outbreak, or measles. Case management, we know what's been going on over the past 12 months in terms of clinical trials and how that's fed into Solidarity and other trials by WHO. Infection prevention and control, we've done studies on, transmission of Ebola outside health centres and whether it can be picked up from, grass outside. It's been isolated from grass outside health centres. So again, infection prevention control measures are crucial. Use of masks, use of disinfectants, use of PPE are all part of IPC. And then finally, vaccination programs. And I've worked a lot on measles, polio, cholera, Ebola, and obviously the SARS-CoV-2 vaccination program now is a major part of countries' response to the pandemic. And that book, Communicable Disease and Emergencies, is one that I had worked on, which is used by NGOs working in conflict-affected situations. Next. So this is East Timor, which was the 27th province of Indonesia, and you can see this was the destruction. We arrived as a member of the UN team to try and provide healthcare to the population, many of whom had been displaced to West Timor at the time. Next. And dengue was a major part of the disease burden there, with a lot of children, and both malaria and dengue. And I conducted a mosquito survey along with a number of Australian entomologists. Next. So the UN response in Afghanistan, and this is in 2002, and it was on the foot of 23 years of a civil war. So Afghanistan was in a difficult situation in terms of child health. Next. So 1 in 4 children at that time were dying before reaching the age of 5 years of age. Measles caused about a quarter of deaths, which was about 35,000 a year. So there was a plan put in place to implement a mass measles vaccination campaign targeting children from 6 months to 12 years of age. At the time, the coverage rate was only about 42% in the under 5 age group, so very low vaccine rates. So a program was implemented by UNICEF and WHO with the Ministry of Health and NGOs, and over 10 million children were vaccinated over a period of 12 months, which corresponds to about 82% of the target population. Next. And this is just showing, I mean, we've seen the heroics that are being, and the amount of effort that's gone into the vaccine rollout here. And obviously the numbers are greater because it's an all population intervention, but I think we can all understand the logistical challenges of a vaccine that requires injection, and the whole importance of safety of injection, safe disposal of needles, training of vaccinators, the recording of data, management of side effects, monitoring of any possible sequelae down the line. So it is a challenging endeavor in any situation, but particularly in conflict countries or areas where there's been very poor infrastructure. Next. So this is one of WHO's other roles, in addition to responding on the ground to pandemics, to outbreaks, or to humanitarian emergencies. WHO's core role is on international norms and standards. So it's a global standard setting body for international health. and we produced, the organization produced fact sheets and technical guidelines. And this is one that was produced by my department in 2004. Next. The risk assessment looked at waterborne diseases and vector-borne diseases. It also looked at risks posed by corpses following a natural disaster, and other risks such as drowning, injuries and trauma. And preventive measures were outlined, including chlorination of water and vaccination and management of corpses following mass casualties. Next. And this is the tsunami that hit on the 24th of December 2004 with approximately 230,000 deaths. Next. And this is a picture of a mass burial in Thailand, and this was replicated in a number of countries, particularly Indonesia, Sri Lanka and Thailand were the 3 countries that were most affected. And those technical guidelines were used by agencies to try and ensure safe burial, ensure there was no contamination of water surfaces, and that where possible people were identified, although it proved a challenge in some of the mass burial situations. Next. The UN response to the Syrian crisis, this is going on since 2011. Next slide, John, please. So we've about 13 million people displaced out of a total pre-war population of 22 million, 6 million in Syria, 7 million in neighboring countries. Huge problem with shortages of healthcare workers and low hospital capacity, overcrowded camps and outbreaks of measles, typhoid, hepatitis A and polio. Next. And this shows the range of agencies that are working to provide humanitarian assistance. UNICEF, OCHA, the Office for Coordination Humanitarian Affairs, the Red Crescent Society and WHO, again, working to try and provide humanitarian relief. Next. And this is a picture of Zaatari refugee camp, which I was involved in a health assessment there to look at the health needs and the polio vaccination uptake in the population. Next. And this is a Zaatari camp. Zaatari was actually established in the 90s in response to the Iraq crisis. And at the moment, it's the 2nd largest refugee camp in the world, with about 110,000 refugees living there. Next. And part of my work there was to look at the polio mass vaccination campaign and to assess the percentage of children under 5 that have been vaccinated. And we did this by looking at how many kids had a mark on their index finger, and indelible ink was put on each child's finger if they were vaccinated. We found at that time about 75% of children had been vaccinated. And some of these were in pop-up sites along the road from Amman to Zaatari camp. Again, people who had run out of money for renting houses in Jordan, in Amman, in the capital, and had moved these sites along the roadside. Next. So very briefly on Pandemic Risk and Emergency Management Project, completed in 2017. We looked at 3 areas: surveillance, communications and governance. Next. We did a threat analysis. We looked at naturally occurring pandemic risks, accidental risks and deliberate risks. So the threat of a biological attack, of use of a bioweapon. We looked at SARS, MERS, CoV, influenza A and Ebola. And we also looked at the driving processes: emergence, amplification, propagation. And as Joanne said, we concluded at the time that the risk was higher than ever before. And I can say that even at this point, the risk going forward continues to increase as increased deforestation occurs, increased intensification of farm practice, and increased traffic and movement of goods. Next. Pandem 2 is a project that followed on from the phase 1 project, where one main conclusion was that the IT systems that were available to manage a pandemic needed to be strengthened. And in order for an EU-wide approach, there needed to be more consistency across countries in what was collected and what information was gathered. Forecasting, it will include tools for forecasting, resource planning, communications and workforce capacity. 2-year project, 19 partners in 13 countries and a budget of 10 million. And the example there is of the dashboard that will be produced at the end of the 2-year project. Next. So in terms of my role in the COVID-19 response, Sandra has mentioned, Joanne mentioned that I'm on the Irish Epidemiological Modelling Advisory Group, which is led by Professor Philip Nolan, the president of Maynooth University. And this group, we work on modeling of disease transmission, forecasting the next 2, 4, 6 weeks in terms of where we'll be in terms of the pandemic, the trajectory of the pandemic, estimation of the reproduction number, and analysis of healthcare supply and demand. And I'm also working on the expert advisory group, which is led by Maura and HICWA. This provides evidence-based advice to NEFIT to inform policy. And I've also been working with the Department of Further Education, Further and Higher Education, and the Irish Universities Association on the response plan for higher education institutes. Next. So what have we learned? Very briefly, we have seen the rapid development of diagnostic tests. The PCR test was developed within 1 week of the virus sequence being made available by the Chinese authorities. Lab-based PCR diagnosis became the cornerstone. Testing got to scale with good turnaround time and a positivity rate of less than 5%, other than at short points during the 2 most recent surges. A lab and geospatial data fed into the COVID-19 tracker app. Next. Access to real-time data was available in an unprecedented manner, both through the HPSC, through the HSE and the DOH. There was a lot of information available on EU and global level from ECDC risk assessments and also from WHO, who subcontracted a lot of the work of data presentation to the Johns Hopkins University. WHO convened expert networks in clinical management, laboratory and virology, infection prevention control. They also ran research and development for diagnostics, therapeutics, and vaccine development. And as you all know, vaccines were developed in an unprecedented timescale, which much of this was supported due to advances in data sharing and IT systems. Next. In terms of the EU-wide approach, while there was a commitment to this at the outset, the reality is that each member state focused on its national response. There were challenges and continue to be challenges faced by EU countries due to the open border policy, and there still remains the challenge of trying to reduce the risk of importation of cases. And I think we're addressing this at the moment. Joint procurement of vaccines reduced the cost and access. I think important point is the access to vaccines by developing countries will be needed to control the pandemic. Next. So the lessons for future pandemics. Future emerging infectious disease threats may have higher mortality rates. And speaking to a colleague in WHO in Geneva over Christmas, said that we will look back and thank COVID for what it has taught us, because whatever is out there, we could potentially be diseases with a higher mortality rate. The developments in diagnostics and vaccine technology will stand to us, will support future response and hopefully reduce the timeline from detection of a new pathogen to the development of an effective vaccine to even shorter timescales. I think we need to be looking at the measurement of the economic, educational and social impact, and I would include in that the mental health impact of the restrictions and the measures that had to be implemented over the past 12 months. I think there's an interesting examination of the role of women leaders, heads of state, for example, New Zealand, Germany, a number of the Nordic countries. We've seen the importance of public health medicine, laboratory and hospital surge capacity, including ICU beds. And finally, the importance of research on real-time data informing policy. So that's it. Thank you.
Thank you so much, Maura. I have a question here for both of our speakers. Thank you both for your insights. Could you tell us about any role models you might have had over the course of your career that have been really inspirational, or any mentors or supporters that might have been helpful along your career journeys? And I'll start with Maura, if that's okay. Thank you.
Okay. I think Gro Harlem Brundtland was probably the one woman that really inspired me. Gro had been the Prime Minister of Norway and trained in medicine and in public health medicine in Harvard. And she joined WHO as Director General in '97. And I worked with her on the Kosovo response and also on SARS-1. And she was a magnificent politician, public health physician, and global advocate for health. I learned a huge amount from her. I remember particularly during SARS-1 when there was an issue of whether we would impose a travel ban on Toronto. And she asked everybody around the table, what would they do? What would their advice be to their family members? And then she said, okay, she took everybody's advice, everyone's counsel. She said, now you can leave, I will have a decision to make. And we look back on it now and see the magnitude of this SARS-2 to SARS-1 was incredible. But a lot of the team that are now currently working in Geneva cut their teeth and learned from Gro and how she managed as a head of state to manage a pandemic of international importance. So I think she's one of my role models. And Mary Robinson is somebody that I've always admired. And while I was in medical school in Galway, I followed her work very closely, and her work in Trinity and her work on women's rights.
Thank you. And same question for Aoife.
So my role models, I suppose, the people who influenced me the most are actually the people I met in Trinity, who I ended up working with. So they happened to all be males, such was the nature of things. I didn't have any women to choose from so much, but so it was Professor Dave McConnell, who was head of the department when I was a student and still there when I joined the staff, and my PhD supervisor, Ken Wolfe, who's now in UCD. And they were both just really, really encouraging. And I think one of the things about Ken that was, he was a good role model because his wife is also a full-time academic, and they have a child, and he did his share of things, and meanwhile also managed to be one of the most impressive, most accomplished people in my field. So he was a really nice counterexample to that myth that you have to choose basically between your career and being a good family person. And this myth that I think people use to try and beat other people down, which is to tell them, if you don't give every minute of every day and all of your weekends, you're not really dedicated and you're not really good at it. So I had those very nice, he was a very good counterexample and just a really encouraging people who, just helped me in terms of helping me being willing to put myself forward and to go for things. But also I have to echo, it's also Mary Robinson is somebody who I just have such admiration for. Like I remember when she got elected, if I think of her Manana Heron speech, I still get a little shiver. And so when she became Chancellor of Trinity, that meant that she would attend she wouldn't attend every degree award ceremony, but she'd attend the kind of the big occasion ones, and the big occasion ones where they give out the honorary degrees. So when I got my PhD, I made sure to apply to be in that ceremony. So it could be Mary Robinson who handed me my degree certificate, and that was really special for me. So she said it to everybody, but she handed it to me, shook my hand and said well done, and I was like it was Mary Robinson. And I've had the opportunity to meet her a few times since then, thankfully, with her involvement in Trinity. And she was just she's just such an extraordinary woman. And when you think of the times that changed so much in her lifetime, largely due to her work, she did so much. She wasn't a just a bystander. She was making things happen, and we're all beneficiaries. And I'm so proud of her. I'm so proud of her as President of Ireland. I'm so proud of her international work as well, with the UN High Commissioner for Refugees. And it was refugees or human rights. I always get those acronyms mixed up, but she's incredible. And so anyway, that's another one.
Thank you.
Hi, this is Susan. The question for both panelists. The idea is, what's your opinion of the COVID-19 vaccine passport that people have been talking about? Do you agree or disagree that it's a good idea?
Well, I'll kick off. I think it's something being looked at European level, and I think it will be necessary in order to facilitate travel. So I know member states are looking at that in terms of allowing safe opening of countries going forward.
Yeah, I don't have much to add to what Maura said there. Just I think there's a difference between the vaccine passport now, when like a handful of people are vaccinated, versus later towards the end of the year when it'll be a different situation, I think. But I think it's one of those things where it is a good idea in the long run.
Thanks.
Thank you so much. This has been very interesting. We have one question from the Q&A from the attendees. for both of you. Do you have any concerns about the potential specific impact on women of the COVID vaccines, in particular the lack of clinical information on aspects such as fertility, as well as the lack of data in pregnancy and breastfeeding? This was asked by Marie-Therese.
Okay, well, the clinical trials were done with both male and female participants, with extensive data gathering, so I wouldn't have concerns. There were the level of research, the work that's gone into clinical trials, the monitoring, and to ensure gender representation would give me full confidence in the vaccine in terms of its safety of use in women and men.
Yeah, same, nothing to add there.
Thank you.
Hi, we have another question then from the question box from the audience. So they said, thank you for a wonderful presentation. But they wanted to ask, they said, do you have any advice to give hope for this third lockdown? People are very disheartened and seem to be getting different messages from different leaders. And they want to know, is it time to get a clear message from just one leader?
Okay, maybe I could start. What's very heartening are the huge reductions in numbers of cases in healthcare workers and among residents of nursing homes. There's been a 95% reduction in cases among healthcare workers, and that's a really positive development. And we are seeing the admission rates to hospitals coming down. We're seeing people coming out of ICU and numbers of people in ICU coming down. The issue now is to prevent long COVID, essentially. We will get to a point that as long as those who are vulnerable in our society are vaccinated, we will hopefully avoid too many future deaths if people are vaccinated. The issue is, as this will take a number of weeks and months to get everybody covered, how do we minimize the risk of long COVID? It is a much more challenging situation now compared to last November. We're dealing with essentially nearly a new pandemic, even with increased transmissibility, but also increased severity. The latest information from NervTag from the UK is that this new variant B117 is 30% more, has more severity, a greater impact in terms of the clinical progression. But as we have protected those, we are in the process of protecting those most vulnerable, we will hope not to see that in the younger age groups. So I think it is a delicate balance between opening the country up and ensuring we've got sufficient protection of those vulnerable. And in the meantime, making sure that as the younger age groups are still vulnerable to infection, that we reduce the risk of infection, and we use the testing capacity that we have now for serial testing, repeated testing, that we make sure we keep our schools safe with this increasingly transmittable virus. And I think, you know, everyone is trying to do the best they can. I think the positive thing is that the end is in sight. You know, I have seen graphs where the graph comes down to baseline in the summer. We don't know exactly when, but, you know, if we continue our commitment to the vaccine rollout, and it's been a really heroic effort by all of those working on behalf of the population to get this vaccine out. So I would be optimistic that we will get there, but everybody has to play their role. And I think the important thing is, even if you are vaccinated, there is the potential that someone can still be part of a transmission cycle. So we all have to maintain all those recommendations and health messages that we've been hearing for the last 12 months.
And maybe I'll just add to that. So I agree with everything. And then I think another point of optimism is that that this virus doesn't move around by itself. So when people do what they're doing, they are stopping it from spreading, they are breaking chains of transmission. And so no matter how scary it all sounds, there's still something we can do, and we're getting back on top of this, which I think is the really good news. And I think the other thing is that the Irish people have shown that they understand very well. You know, if you look at the way people react, you know, Irish people, when you look at opinion polls, they've said that they would they'd rather have the restrictions to get this down. They don't enjoy the restrictions, but they accept them. They understand the point, and that they would like, you know, to do it right and not have to go into, like, to kind of get it once and for all. And I think that is another point of optimism, that there's good understanding and good, you know, it's an acceptance. It's not an enjoyment of what's happening, but people understand and accept what's happening. And I take a lot of heart from that too.
Thank you very much.
I see a question in the chat as well.
We do have a few more questions, but I think we're just up on time at the moment. We've just come to 7 o'clock, but we will, for any questions we didn't get around to, we can send them on to Aoife and Maura for them to read after the event. But I just want to say massive thank you to everyone for being with us today on International Women's Day 2021 to celebrate these two Irish scientists, Professor Aoife McLysaght and Professor Máire Connolly, and to acknowledge the important work that they are doing for Ireland in response to COVID. And in terms of the COVID narrative, you know, we all recognize the names Tony, Ronan, Luke, but I truly believe that all households should know the names Maura and Aoife as well in response to this crisis.
I wholeheartedly agree there, Joanne. I think it was an absolute privilege to spend, you know, International Women's Day 2021 with Aoife and Maura, and to hear their perspectives. And I've learned so much tonight. And I think also Maura's slides showed us that, I mean, yes, things are difficult for us here, but look, you know, we are so much better off. You know, we are not in a war zone. We are not in a refugee camp. You know, most of us have the comfort of our homes. I know there are homeless people in Ireland as well, and they're being impacted by this pandemic. So, but it's good to get perspective on things. And also, you know, sometimes it takes a pandemic to be ready for the next pandemic. As Maura said, there could be things coming down the track, and we need to be ready and prepared. So hopefully lots of lessons learned. So it was utterly inspiring listening to you both. And thank you so much for giving your time to us, to our two associations, and wish you both the very best for your ongoing work and your research. And yeah, very, very proud to have you had, you know, with us tonight, you know, and very, very delighted. And I think you deserve a round of applause from us and from all of those on the call. So I'm just going to give you a virtual surprise applause. So thank you.
Thank you. It was a pleasure.
Thank you very much. It was a real pleasure to spend the hour with you guys. Thank you.
Thank you both.
Okay.
And happy International Women's Day to everybody.
Thank you.
Thank you all for joining us and for tuning in.
Thank you, Sandra.
If you'd like to keep an eye out for future events as well, check the Trinity Women Graduates website, and also Women in Research Ireland are organising a mental health seminar series for researchers, which will be free and online, upcoming in the next few months. So thank you all.
Thanks, Joanne. Thank you. Bye.